Concerns are growing now over the potential spread of monkeypox here in the U.S. One case already confirmed in Massachusetts and now a case under investigation in New York City. And this comes as just over 100 cases have been identified in 8 countries around the world. ABC News medical contributor and emergency physician Dr. Darien Sutton joining us now for more on this. Okay, small numbers, however, this comes after monkeypox clusters were reported in places like Canada, the UK, Italy, France. The cases outside of the disease's typical territory. So what exactly is it, and how worried should we be about monkeypox?
Well, good morning, Kira. So monkeypox is a relative to the smallpox virus, which many people may remember, but some may not. Thanks to the smallpox vaccine, it was eradicated in 1980, but monkeypox still remains prevalent and endemic in parts of Central and West Africa. Although it is concerning, we shouldn't have fear at this moment because it still remains rare, and the path of transmission from person to person is quite difficult in comparison to COVID-19.
Well, how does this compare to COVID-19? Similarities, differences, what do you know?
So based off of similarities, first off, prevalence. COVID-19 obviously is widely prevalent, and you can always come into contact with it or at risk of coming into contact with it, as opposed to monkeypox, which remains rare in these cases, are relatively isolated. In terms of transmission, monkeypox requires close contact, usually skin to skin. And the most common form of transmission is actually something that we call zoonotic transmission, which means that it's going from animal to human, as we found it often in rodent species and populations. But luckily, again, the rates of infections that we're seeing still remains low, and often the level of infectiousness is usually after symptoms start, which helps people to better protect themselves from exposing others.
Well, then what are those symptoms to look out for?
So the symptoms can be variable, but most commonly include fever, headache, swollen lymph nodes, or something called lymphadenopathy, and then, of course, that textbook blistering rash that we've seen circulating around the internet. If you see any of those signs or symptoms, it's important to identify the closest medical provider that you can find, isolate yourself, and also, if you can, call the Department of Health if you're concerned that you might have been exposed.
All right, one more question. The CDC is also monitoring the health of 6 Americans now who are on the same flight as that British person who tested positive for the monkeypox. So what more do we know about this and the potential risk to those folks?
So they are likely in some form of isolation, because we do know that the incubation period, or the time from exposure to the onset of symptoms, can last anywhere from 1 to 2 weeks. So I'm assuming that that's what their isolation is for. There might also be involvement of prophylactic medications. Sometimes we do have the smallpox vaccine still available. We use that for high-risk patients who have been highly exposed. That might also be used. And then if someone were to become infected, there are treatments available, many of them similar to the way that we treat smallpox. But again, we try to make sure that we want to provide some calm, because it's still really, really difficult to get this virus.
All right, well, awareness is good. Dr. Darien Sutton, thanks so much.
Of course, thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.